My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned. My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.
In the course of the show, we'll open our phone lines. You can call us, comment, suggestion, whatever it is. My doctor is here to answer you. Now, in recent times, we've had few instances of children being diagnosed with cancer, and this is really heartbreaking when you see a mother having to lose a child to cancer. According to research, a lot of these common cancers can be treated on condition that is picked up very early enough. They are brought in for treatment. For this whole month of September, the Society for Children, Pediatric Society of Ghana has a campaign on childhood cancer, creating a lot of awareness as media engagement. They are talking to parents, stakeholders that childhood cancer is there. This is what you can do. These are the signs and symptoms you can watch out for so your children can be brought in for treatment. So I have here a doctor from Rich Regional Hospital want to talk about childhood cancer. But before then, we'll pick a break from our sponsor, Rohi Children's Clinic, as she talks about cancer. A time with Dr. Abner. We'll be back.
Think cancer is just for adults? Nope. Kids can get cancer too, you know. But the good news is that there is hope. Most childhood cancers are curable if caught and treated early. So watch out for these signs. A white spot on the dark part of the eye, or lumps or bumps anywhere in your kid's body, including the tummy. Or if the child gets sick frequently or turns suddenly pale, or if the kid is bruising or bleeding very easily, it could be a sign of cancer. If you notice any of these, don't wait. Get the kid checked out. Early detection saves lives. Share this to spread awareness.
Cradle to Crayon Show right here. Don't forget we are live on Facebook. Our Cradle to Crayon Facebook page, Sunny FM Facebook page. We're also on Sunny TV. Can watch us and join in the discussion. Thank you to Rohi Children's Clinic, sponsor. They say they receive more than treatment. You get full attention in a caring atmosphere. Their services include specialized care for diseases of babies, children, and adolescents. They do child well clinics, laboratory services, health screening, The school health services for new entrants and continuing students. They are ready to serve you from Monday to Friday from 8 a.m. to 7 p.m. And on Saturdays, they are open till 2 p.m. Locate Wohi Children's Clinic at Reese Junction at Denta or call them on 0200 342 960 or 0592 053 234. Their website is www.rohicc.com. Rohi Children's Clinic, experience total care. Now visit back Specialist Hospital and Fertility Center for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, surgical service, that's both general surgery and also plastic surgery. They do theater service and also laboratory and ultrasound scan service. Locate them right in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196 003. Bath Specialist Hospital and Fertility Center, integrity and excellence in healthcare. Our WhatsApp line is 0541 130 684. My guest is Dr. Abigail Mawusi Quest. She's a pediatric resident with the Greater Accra Regional Hospital. Dr. Quest, good morning.
Good morning.
And it's good to have you here.
To have me.
Yes, yes.
Good morning to your listeners too as well. I'm happy to be here this morning.
Good, good. So, childhood cancer. What is childhood cancer?
Okay. Before I start answering the question, I would want to say a special good morning to the medical director, Dr. Leslie Adam Zakaria of the Greater Accra Regional Hospital, and to the pediatric oncologist at the pediatric unit, Dr. Nihat Salifu, and the team of the pediatric department of the Greater Accra Regional Hospital for this opportunity. So childhood cancer.
Yeah.
So basically, childhood cancer is cancer that affects children, and cancer simply means when you have abnormal cells in your body that divide rapidly in a disorderly manner, and that results in the development of a lump, or that could spread to maybe your blood and other parts of your body. So we all know that there are cells in our body, and those cells have been programmed to develop, to replicate, grow, and then eventually die. So that's the whole process. Just like how you have a child, a sperm, egg is fertilized, it undergoes development, and then a child is formed. So during that whole process, you can have something going wrong in your cells, and when that problem occurs, then you can have defective cells that grow rapidly in a disorderly manner. That usually results in development of cancer. So they usually grow big, they extend beyond their bodies, and they can spread to other organs in your body, including your blood. So basically that is what cancer is, and they do occur. And a lot of people out there are not aware that children do develop cancer. They are aware we have adults developing cancer, but children also do develop cancer. Yeah.
So I was even coming to that. So the awareness of children having cancer is, people really, they doubt it and know there's a myth, children don't get cancer. But is it the same as what adults get?
Okay. So the information from the little research we've done, asking the public about their knowledge of childhood cancer, a lot of them do not know that children do develop cancer. They thought cancer was a thing for adults only, but they don't know children develop cancer. And unlike the adult cancers, childhood cancers, the cause is generally unknown. But with the adult cancer, what happens is that it's usually related to certain lifestyles, smoking, drinking, your diet put you at risk of developing cancer. Unlike the children, it's more of genetics. Yes, so the cause is generally not known.
Okay, you can't really pinpoint a cause to it.
Yes. However, there are certain things that put you at risk of developing cancer. So for children especially, the genetic makeup, where there's a defect in your cells, you can have those children developing cancer. That is through no fault of theirs. during their development, in the growth of the cells, there's a defect. Like how you have in a factory, the production process, there could be a defect, and you can have a defective product. In the same way, during the development of a child, from inside the womb of the mother till when they come out, they keep on growing. So when you have a defect in the growth of the child, the cells in the child, you can develop cancer. There are instances where you can even inherit certain genes that puts you at risk of developing cancer. So it doesn't mean the moment you develop the genes you will get it. It puts you at a higher risk of developing something like Down syndrome. So, children with Down syndrome have a higher risk of developing most of the blood cancers than other children would. Yes, and then there are other things in the environment that can also put children at risk of developing cancers. Examples are the benzyl sulfate, like certain chemicals that we use
be exposed
in the food.
to.
Yes, in processing our foods, especially the processed foods that we have, it puts you at risk of it. And then you could also, when you're exposed to certain radiations, so as you are developing, you are exposed to certain radiations that will affect the development of the cells, will also put you at risk of developing cancer. Yeah. But majority of the time, childhood cancers, the cause is unknown, and it's also due to the genetic defects that put them at risk of developing cancer. And I also want to say out there that it is not through any fault of their parents, what the mother ate during pregnancy, or what they did, unlike the adult cancers. And then also the notion out there is that they say the child is cursed, due to witchcraft. No, it's not due to any of those things. So basically that is what causes cancer in children.
In terms of the genetic makeup you mentioned, so when a child gets it, would you recommend that if the mother has other children, you want to also test them and see the likelihood of they also developing it?
So like I mentioned, so we have the inherited ones, where I said that there are some certain inherited genes that can put you at risk. So let's say a child comes to us and we suspect that it could be due to a gene that was inherited. Then we can go ahead to further test the child to say, okay, do you have that genes? Do your parents have it? That puts you at risk of developing the cancer. That is so we don't. It's not routinely done because it is not really common. We just have a few of the cases resulting in that, but majority of the cases is due to defective genes and a mutation in their cells that causes the cancer.
Let's look at some common cancers in children.
So in Ghana here, the common, even in the in the whole world, the blood cancers, what we call the leukemias, are the commonest form of cancers in children, and that is the case in Ghana too. The next commonest ones we have are the cancer of the kidneys in the children too. We call it the Wilms tumor. So we also have those ones. Those are the very common ones that we hear. But aside that, we have other cancers that also occur in children in Ghana. We can have cancer of the eye. We call it the retinoblastoma. Then we could also have cancer that affects certain parts of it. So it can occur in your abdomen, in your jaw. So any cell, any part of your body you can think of, can develop cancer. But the common ones are the ones that I spoke about. That is the leukemias. That is the cancer of the blood. Then you could also have the Wilms tumor, which is the cancer of the kidneys occurring.
How early do children get it? I mean, what's the earliest you've seen?
So personally, the earliest I have seen is a child who is a year and a few months old.
That's early.
That's early. So you could have babies actually getting cancers.
So for that one, it was picked up right after delivery.
So in certain cases, you could pick it up. So that would mean that it started intra-op. That is, it started occurring when the mother, whilst the child was in the mother's womb, and then it was only picked up when the child came out. Yes. We could also have some occurring, being seen only when the child visits the hospital. Yes. So maybe they come for weighing or they come for postnatal care, or the child fell ill during infancy and then it was picked up. So usually that is what happens, but majority of the time they present late.
Why do you think that happens? Why are they coming in late?
I would say it's due to lack of awareness. of childhood cancers, and then the early signs that come with it.
Okay.
A lot of the public, including health workers, they lack the adequate knowledge in knowing what the early warning signs are. One, they don't know that children do get cancer, so that's not
The health workers themselves.
no, I mean the public, the general public.
Okay.
Yeah, but the health workers, they are not able to pick it up early.
Okay.
Yeah, some of them are not.
Some of them are
Yeah,
not.
so that is why we are trying to create awareness. With childhood cancers, like I said, you cannot prevent it from happening. You can't prevent it from happening. Unlike the adult cancers, where I mentioned that lifestyle.
Due to lifestyle.
You could. So once you have those lifestyle modification, it reduces your risk of developing cancer. But children, you cannot prevent it. What we can do is try as much as possible to pick it up early. So that is why the awareness creation is very important. The month of September is the Childhood Cancer Awareness Month worldwide. And we use that opportunity to educate the public about the what childhood cancer is, the early signs they should look out for when a child presents with it. So usually for children, a lot of them are not able to talk, but there are certain things that you see. So we start with the eyes. So the pupil of the eye, that is the black of the eye.
Yeah.
You would see a white spot.
Okay.
Yeah, in there. That is also an early warning
indicator
sign.
that there's a problem.
So you could have children who complain of constant headache, recurrent headache, and then it's usually associated with vomiting early in the mornings,
Okay.
which is going on for such a long time. You should have it looked at. You could also have children who have continuous weight loss for no reason. They are eating all right, but they are not gaining weight. They keep on losing weight. That is also an indication. You could have a child who has fever, which is not due to any infection. The child keeps having fever. You treat, it goes on for a long time. You need to seek further management. Then you could also have children who have recurrent infections. They keep having infections. They treat
In and out of the hospital every
continuously
time.
for a very long period of time. Then that is also one of the early warning signs. You could also have children who feel very tired easily. They barely can do any activity. They are looking pale all the time. That is also a sign. Sometimes you could also have children, they bleed easily. So they are brushing their teeth, they are bleeding profusely. I'm not talking about maybe you are using those smoky toothbrushes,
Okay,
like
the hard
just,
ones.
not the hard one, just the normal toothbrush, normal brushing. They are always bleeding. They easily bleed. You check their skin, their
Bruises
bruises all over. That is also an early warning sign for you. So you could also have a child who complains of constant pain in the limbs, either the arms or the legs or the stomach, constant pain that doesn't go away. Or you notice a child who was previously walking fine has started limping, complaining of pain.
The
and
child fell down.
The child didn't fall. No
Okay.
history of
Okay.
trauma. But sometimes child could have fallen, but the thing was already there.
Okay.
Yeah, so you have to probe further. So
Okay.
that is also an early warning sign. Then also you could have lumps. Child develops a lump either in the neck region, on the head.
That's a swell.
A swelling.
Okay.
Yes. On the neck, any part of the abdomen is getting distended and is growing gradually. You have to have it looked
Okay,
at, because
okay.
that is also one of the early warning signs of childhood cancers too as well. So all these things needs to be picked up. A lot of the cases, you have parents coming to us. So I was bathing my child and I felt a mass in the abdomen.
Okay.
And it seems to be growing big. My child is not gaining much weight. They come to the hospital, we evaluate the child and realize that the
There's
child has
something
developed
wrong.
some
Okay,
cancer here
okay.
or there. So you pick up certain signs. It's okay for you to just go to the hospital to have it looked at. It's better to err on the side of caution than to just let it go.
Let it go. You had mentioned headache vomiting, so this is not going to be one time. Once it's happening continuously,
Continuous
something
headache.
issue.
Yes, that keeps on going on for a very long time, and you take pain meds, pain relief. It gets better, but comes back again, or it's not completely gone. It goes down a bit. You should, and then it is mostly maybe usually as may or may not be associated with early morning vomiting.
Okay.
Yeah.
Okay.
So usually, especially the cancers of the brain, do present like that. So that is why it's important to have it checked, because a lot of the times they'll go through the motion. The child comes with a headache, they first go to the pharmacy or the chemical shop to get some pain relief or some medication. It's ongoing. The next thing is maybe they'll go to a hospital and they also check. The child may happen to have malaria, they treat it, child comes back still complaining of headache, not going. You need to have a look at it. So yeah.
It's just 10 minutes to top of the hour. Time has gone by already. I have here Dr. Koch, is a pediatric resident with Greater Accra Regional Hospital, discussing childhood cancer. We say thank you to our sponsors, Back Specialist Hospital and Fertility Center, Rohi Children's Clinic, and also to secure sanitary pad. Our phone lines have been open. I'm to call it 0540 130 684. 0540 130 684. It's also a WhatsApp line. Send us a WhatsApp message. My doctor here will answer you. Dr. Kwe, so after all these, the child comes in. What's the next step?
So the next step is we would need to diagnose this child. So diagnosis means we need to do certain tests to show, to let us know the type of cancer. One, if the child has cancer in the first place, and the type of cancer the child has. So from the history, that is what the story the parents will see, how the whole thing started. We'll get to examine the child properly. Then we'll go on further to do certain labs. So sometimes you do lab workup. So you take blood samples to run tests. Sometimes you could do an X-ray. You can do a CT scan or MRI. All those things are done. Sometimes you take certain samples from the bone marrow of the child to be able to run a test.
Okay, let's pick this call.
Yeah.
Hello, good morning.
Good morning, madam. Is that Sunny?
Yes, this Sunny.
Please, how do I download the Sunny radio on my phone?
Okay, we'll text it to you. We'll text it to you. Thank you so much. We'll send it to you. Bye. Yes.
Yes, so like I was saying, so you do the blood test, you do the imaging where you have X-ray, you can do a CT scan, you can do an MRI. Sometimes we take the bone marrow, when you have the bone, the middle part of the bone, and we take samples of that to run tests to know if this child has cancer in the first place, and the type of cancer.
Okay.
Because each cancer, the treatment is different. Yes. So that's what we do. And sometimes you also want to look out to see if the cancer hasn't spread to other parts of the body. So those are the tests that we do. And these tests are quite expensive. Majority of them are done in Ghana here. Some of them, they take the samples and send it outside the country to India, South Africa to have it tested. And the results come back. Like, remember I mentioned that most of the cancer cells divide rapidly.
Yeah.
So that is why it is important we pick it up early. Because the moment you wait, you delay, the proliferation, the growth is still going on. The cancer is still spreading. So the diagnostics, the test that needs to be done has to be done early. We get the results early, then we can start treatment.
Okay.
But a lot of the time, because of financial challenges and lack of some of these specialized tests not readily available, there's a delay. But usually when they come, we try as much as possible to get all this thing done as early as possible. But the problem is the cost. It's quite expensive.
Does the health insurance cover it?
No, the health insurance doesn't cover it.
It doesn't cover the treatment.
Okay, so recently health insurance we had 4 of the childhood cancers being put on health insurance.
Okay.
But the challenge there with the health insurance is that majority of the medications that that are used in treatment of these cancers are not available in the treatment centers.
Okay.
Yeah.
But they are in the country.
They are in the country.
Okay.
Other private pharmacies are bringing it into the country, but they are not available in the treatment centers.
Okay.
So once they are not available, you have to write a prescription for them to
have
go
to
and
go and
buy
buy.
it. Yeah, and that's where the challenge is.
How does this whole thing affect the child's life? I mean, the child has to go to school. Then you put it on hold and go through the treatment process?
Okay. So before I speak about its effects on the child, I would like to share more light on the treatment.
The treatment,
modalities.
great.
Yes.
Great.
So with the treatment of childhood cancers, like I said, there's treatments for the childhood cancers. Majority of it, when you treat, they are curable. You pick them early, they are curable. And we have chemotherapy where they give certain drugs either through the IV line, or they give it to them orally to take, or they inject their back as treatment. You could also have surgeries being done to remove the lumps. That's okay. Then you could also have radiation therapy where they use radiations to burn up all the cancer cells in the system. And then we also have other supportive care that we give. When a child is in pain, we give pain. They need blood, we give them blood transfusions. So with the effect on the child.
Before you come to that, do you consider their diet and nutrition, what they are taking now, and everything in during the treatment process?
Yes,
As well.
it plays a key role.
Okay.
Because
Okay.
a lot of these children, like I said, one of the presenting signs is that they lose weight. Yeah, a lot of them tend to lose weight, and then it affects their immune system. So they need to eat well, gain more weight, boost up their immunity to be able to. Some of them, their immunity is really down. So as part of the treatment, we have other supportive care where we have a dietitian or a nutritionist available at the treatment centers to ensure that their nutrition is optimum. Yeah, it's really very, 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 very important. Then the other thing too is that we also have other supportive staff, like a play therapist. In Greater Accra Regional, we have a play therapist who comes in, because these children, some of the treatments can take as long as 3 years. And you can have someone being in the hospital for so long. Personally, I've seen a child who has been on admission for 9 months.
Wow.
So you could just imagine this child has been in the hospital for that long. They are still children, and we shouldn't take the childhood out of them just because they have cancer. So we have a play therapist who comes around to engage with these children, extracurricular activity, help them write, help them read, play with them. And it kind of makes the environment a bit more relaxing and adaptive for them. So that is why it's really important that everybody comes on board. So the team is made up of doctors, specialized nurses who are involved in oncology. We have the pharmacists, we have play therapists, we have psychologists, who are nutritionists, who all come together to help these children. So that's why it's really, really important, because it has a psychological and emotional tone on the child. And not just the child, as well as the parents who as well. Because a parent who is not in the right frame of mind, who is not stable enough, wouldn't be able to support this child, and then that affects the treatment of the child too as well. So that is why it is really important all these key players are involved. Yeah.
In terms of the psychological, emotional, the stress on the children, on the parent, there's some sort of support group that they have, bring them together to.
So yes, we do have support groups, and we also have clinical psychologists in the various treatment centers who speak to the parents and some of the children who are older, to try to help them, because it's a long journey and they need all the support that they can. And then we also have support the parents. They have parent support groups in Greater Accra Regional Hospital. We do have one where they tend to share their problems. They even have a WhatsApp platform where they discuss some of the issues. So they look out for each other to us, especially when a new child comes, the parent is new at this, looks depressed. So you have some of the old mothers speaking to them and reassuring them that they have also gone through that process, so they should just trust the process. With time it gets better. So these things really help because they have gone through it. When it comes from the parents who have also been through it, it gives them they empathize with them and they're able to relate more with them than with the health workers. So it is really important that they also speak to the other mothers to reassure them that they are not alone in the journey.
How did they receive the news? I mean, a mother coming in, not expecting this, after a series of test labs, and then they tell you. How do they take the news?
Majority of them don't even believe that children do get cancer, so it's a surprise to them. They're in shock. Some of them they don't believe it. They are in denial. But with time, because of the long journey it takes for the process, at every point in time we counsel our patients. Anytime when they come breaking a diagnosis, the team meets the parents, speak to them about it, even before we do the test, we speak to them. Before we start treatment, we speak to them. So because of the constant interaction we have with them, we get to know what their issues are, what their worries are, and let them understand. We help them understand even the treatment, the side effects the children will go through. We let them know, so they get to know all this before it even happens, so they are not taken by surprise. Yes, so that is what we do, and that really helps. Unlike when you don't speak to them in the first place, and then they meet it and they don't know what to do. Yes, so we even give out our numbers to them.
Okay.
And to any point, at any point in time they are
can reach out
confused, they
to
can
you.
reach out to us,
Okay.
anyone in the team, so that they don't have to wait to come to the hospital, because sometimes they go home and they are experiencing certain problems at home. They will call us and let us know about it, and as much as possible we try to help them.
Okay.
Yes, please.
It's 10 o'clock already.
Wow.
Our time is up. Your closing comments, whatever you want to add to this whole campaign before we get out of here.
Okay, so what I would want to say is that childhood cancers are real. Children do get cancer, and we need to pick it up early. So it's important we get to know the early warning signs, so that we are able to pick it up early. Once that is done, treatment sets in. Majority of it is curable, and the child could have their lives back. But what we also want to say is that the treatment is capital intensive, and so we are reaching out to people out there to support them. In Ridge Hospital, we have a foundation called there's a foundation called the Cure Childhood Cancer Ghana, which I am part, where we help with financial support, nutritional support to these children and their families, because a lot of them don't have the means. So we go out there to get some funding for them, because their drugs are really expensive. Imagine you are buying a vial of medication can cost as high as 3,000 Ghana cedis. So how are you going to keep that up the whole 3 years or 2 years? So sometimes we partner with other foundations like the Fairway. Yes, so they also help us and support these children. So we encourage people to support their children who have childhood cancers. And then also, sometimes it's good to pass by the hospital and just come around and play with the children, make them feel at home, so that they know that they are not alone in this journey. Yes.
Thank you so much. Thank you for coming, and thank you to all those who listen. Don't forget, same time to 9:30 to be a repeat broadcast on Sunny TV. Enjoy your day and have a good weekend. Bye-bye.
My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.